Okay. Share. Copy link. All right. Hello, everyone. Well, before I do my intro, I'm gonna just kind of let you guys get started. Come on in the room. Oh shit, that was cool. All right, hello everybody. Happy Sunday, November 13th, 3 days before my birthday. Okay, you guys know why you're here. All right, so let me put up my quote-unquote presentation. But how y'all doing today? Please introduce yourselves down below in the comments. Who are you? Where you're from? What nursing program are you in? Or what nursing license do you have? I'm Nurse Sam. All right, I'm going to be your host tonight, and I'm going to be the host and reviewer of this review. All right, tonight we are going to be talking about how to pass mental health. All right, so I'm giving you guys the tips and tricks, all right, on how to ace mental health and also like pass it when you're taking your NCLEX, exit, HESI, whatever. All right, so nursing school, like mental health, psychiatric nursing, if you want to pass, you should be here. Don't worry about, I almost said Mona Scott Young. That is not Mona Scott Young. That's wrong Mona. Mona Lisa. Oopsies. All right, let's go ahead. Can I do that? Does that show? Oopsies. Wait. Okay, don't mind that. All right, everyone. This is our mental health review. All right. I think I can only put this one. All right, that's gonna change soon. It's fine, whatever, it's fine. But yes, so while I get this together, I see someone's considering an associate's. Awesome. What's your name? Where you're from? All right. So guys, I hope you have there's a couple things that I hope you have. All right. If you don't have any of my study kits for like note taking and stuff like that, make sure you have at least like a pen or paper or something that you can write stuff down, jot stuff down, because I'm about to be dropping some real precious gems. Okay. I'm saying to be a therapist. Awesome. Once again, thank you guys for joining me tonight. We are about to talk about how to pass mental health, how to ace mental health, and pass it in the on the NCLEX. Okay. Is there a specific thing that you guys are struggling with when it comes to mental nursing? Like, I just want to know what brought you guys here. Are you taking mental health? Are you about to take mental health? If you are taking mental health, is there something that you just can't quite grasp or get the hang of when it comes to mental health? Just want to know more. Don't want to know about meds. Okay, gotcha. How to use therapeutic conversations. Awesome. That's like one of the main ones I was looking for, because one of the hardest things about mental health, it's tilted. It's going to distract me. I'm sorry. One of the hardest things about mental health and studying for it is pretty much answering the questions in the way that they want you to. Okay, remember when you're taking NCLEX, and especially like in nursing school, all the scenarios that they're giving you are like perfect world scenarios. Okay, so like it's a perfect hospital or a perfect like medical practice, whatever, medical office. You're not short staffed, there's equipment, like you don't have to worry about all those outside things. Okay, what they really just want to make sure is that you know how to clinically think and judge a situation based off of the things that you learned in nursing school. So when it comes to mental health, right? When you think about mental health, that's not necessarily a physical ailment, right? The hard thing about mental health is it has to do with them mentally, right? You can't see that. So I can't sit here like I would someone that's, maybe like cut out the arms and like bleeding everywhere, or even like someone who's in active labor, or even not active, someone's pregnant, like, or about to give birth. It's not as obvious as that. And so that's what makes mental health so quote unquote difficult. Okay, you have to do a little bit more digging. That's why if you don't have any of my study kits, this is the perfect time to get our mental health study kit. But that's why I themed the entire study kit the way I themed it. I themed it after like Scooby-Doo, Mystery Van, detective. It's giving detective work. And that's exactly what you're going to have to do, especially as a nurse, when it comes to, I'm going to say specifically mental health. Okay, you have to do a little bit more detective work. You have to do a little bit more digging. But the way that you do it, there's a certain way that you have to do it, because once again, this is mental health. So it's more about how you say something than what you say, especially with mental health. Okay. Let's go into my notes. All right, so let's go ahead and get into it. First things first, whether it's mental health, pharmacology, whatever, before you start learning how to study for something or how to, pass a class, you need to know what your learning style is. Okay, that seems like almost like a basic thing, but it's going to come into play, especially during the rest of this live. Okay, whenever you're trying to pass a class, pass the NCLEX, whatever, you're going to be judged on pretty much two categories of things: strategy and content. Okay, content's the stuff that we're going to also go over. It's the things that's going to be within your study guides, within my nursing study kits or study bundles. All that is content. Okay, the content is what does not change pretty much between RN, LPN, that BSN program, that ASN program. The content's going to be the same. Okay. When it comes to strategy, that's more so personalized and according to you. That's why, no one studies the same. No one learns the same. Even though we're learning the same thing, the way we comprehend it, retain it, recall it, it's different between everybody. Okay, so you have to know what works for you. And that was my biggest struggle when I got into nursing school. But once I figured out what my learning style was, I rocked it, period. Okay, so when it comes to knowing, how you study and developing a strategy for you, you got to know what kind of learner you are. What's your learning style? I'm a visual learner. I just saw somebody, Bad said visual learner. I love your study kit. Thank you so much. I'm a visual learner and like a kinesthetic learner, but all of my study kits, all of my resources that I have available for you guys, both like free and paid, pretty much everything is because of the fact that I'm a visual learner. All right. When I was going through nursing school in 2013, 2014, hold on. My computer's about to die, and that sucks. Let's put it here. But anyway, when I was going through nursing school in about 2013, 2014, there wasn't a lot of resources that I had available for me for as a visual learner. So when it came to learning things like mental health, I really had to learn that the hard way. And because I didn't have anybody to guide me, I didn't have anybody that did it the way that I like to do it, or would work with the way that it would work for me. I didn't have that going into nursing school. So I became what I didn't have for you guys. So like I said, the study kit that I have is the mental health study kit. Currently you can get that in the Ultimate Nursing School bundle, the third semester bundle, and our newest bundle as of yesterday, the NCLEX Trick or Treat. Okay. And that is, once again, it's Scooby-Doo themed. It's going to go over all your commonly tested NCLEX things. So if you really need content more so than strategy, then I highly, highly urge you guys to get the study kit in whatever way that you can, or either of those bundles, because it is great as far as strategy and helping you remember the things that you need to know, not just like the fluff. Okay. When it comes to strategy, like my visual learners, my auditory, kinesthetic, my reading, writing. Okay, how you're going to practice this information that I'm about to tell you guys, that's where that's going to come into play. So I'm pause that, stick a pin in that, and put it over to the side. Now let's dive into the actual content behind mental health nursing. Okay, as soon as I can find it. All right, so let me bring up my next screen. When you're trying to figure out like what to study, whether it's the actual mental health nursing course or even the NCLEX, I always, like I said, advise for you to get a study guide and like a comprehensive review. Okay, and I'm about to show you my recommendation and what I use to help you guys. Okay, that's not what I'm talking about, but one second. Oh, hold on. Okay, when I had to go through nursing school, I swore by these books right here. Hold on one second. One more time. Ooh, I swore by these books. So for my actual nursing program, like I said, I'm an LPN, a licensed practical nurse. I don't know if you guys are RN, ASN, RN, BSN, doesn't matter. Our education is still the same. So that's very, very similar, especially when it comes to the overall courses. But we had to do ATI courses, an ATI test at the end of our course. So at the end of our mental health course, we had to pass the mental health ATI exam with like a level like 2 or 3, I can't remember, or higher, or we would fail out. So you could pass the class, but then tank the ATI and you would still fail out. Okay, so, we quickly started using this to study for our actual exams within that course as well. So that is the ATI. This is like my old version. This is the ATI Mental Health Nursing. I don't know what it is about ATI. And for those of you guys that are out of nursing school already, maybe you can attest to this, but the way ATI kind of like highlights information and teaches you the information is almost like another language when it comes to like nursing school and NCLEX. It's always like on an island of its own. So I always recommend like, no matter what your review guide is, your textbooks, whatever, I always recommend adding, or at least perusing through, if you can get it from a friend, I don't know, but I always recommend adding your mental health ATI module. This was ours, like a skinny little book, but this information, let me tell you something. This is a good comprehensive review. This is a great comprehensive review this is the definition of just the important stuff and none of the fluff. Okay, this right here. And then the way that they explain it and the way that they tell you, they're telling you things that are definitely going to be, like highlighted when it comes to like ATI or NCLEX. So it's not just giving you all the information, it's giving the stuff that like you definitely need to pay attention to. So I definitely recommend this. Like I said, I got that with my actual nursing program. Those are included in like book bundles, but I'm sure you can get it from like Amazon. Next thing, and this is for content and strategy, my #1 review book for practical nursing, registered nursing. I am not sponsored by these people. Saunders Comprehensive Review for the NCLEX. This one's the NCLEX PN, but I have the NCLEX RN as well, and I have the updated version, but it's just in a different room. I don't feel like going up and getting it, but I have 1, 2, 3, 4. I have 4 of these books and an illustrated guide as well. Like I said, I'm a visual learner. This is where the content comes in. All right. This is also a comprehensive book, but it's more illustration based. And because I'm a visual learner, that's how I learn. So I don't know if any of you guys are visual learners. Jot this down. Take this down, okay? So these are all Saunders books, I believe. No, sorry. These are Elsevier. This is the illustrated study guide. This is for the NCLEX RN. I don't think there's a PN version, but like I said, the education is still the same. So the content is still going to be the same, okay? Diabetes is still going to be diabetes, whether it's the practical nursing book or the registered nursing book, I promise. Okay? All right, next thing, like I said, it was the Saunders. This is important when it comes to pretty much everything that I'm about to tell you on how to pass mental health and really whatever other course that you have. If you have this book, you're good to go. We included this. This was like the giveaway prize a few months ago for like four people. That's how much I love this book. Like I said, not sponsored. I paid for it out of my own money. I just want to make sure y'all had this resource. Okay, so not only does this book go over pretty much any course that you're gonna have. Like I'm stopping it now. This is maternity. We're talking about mental health. So let's go to the mental health section. Did I pass it? Nope. It's right here. The mental health section. Right here. All right. So this is the purple. This is all the purple. All right. So this is a good amount. This is a great way to cross-reference whatever your PowerPoints from your nursing professors. It's a great way to cross-reference those PowerPoints with the study guide to make sure that you're not missing anything, or make sure that your instructor didn't miss anything that was like of utmost importance. So it's always good to have these like cross-references whenever you're studying and going through and studying for mental health. Another thing that I love about this, okay, besides the book aside, they have online resources at the beginning, at the front page. That's where you get all the information. They have online resources, and I'll make a post about this as well, for you guys to take NCLEX style practice questions, like thousands. Like, this is actually over 4,500 practice questions that's included in the online version of it. And it comes with the rationale. It comes with different ways that you can actually take and assess yourself as far as the nursing school questions goes. Like if you need an exam on mental health that's only select all that apply, you can do that. If you need it on just mental health but you want all the question problems, you can do that. If you need just mental health but you want to practice priority, if you want to practice therapeutic communication, if you want to practice, what was the other one? Really, therapeutic communication was the biggest one. And when I discovered that feature, my grade shot up in nursing school. Okay, I aced mental health. Thank you so much. All right. But yes, practice questions is going to be one of your number one ways to really practice and exercise your mental health skills. Okay, so after reading everything, after going to class and listening to lecture and doing whatever your learning style says is best for you for as far as like repetition and studying, this is when you're going to take take all that and apply it and take your practice questions to see how you would do. You're assessing yourself to see how you would perform both in your like chapter exams for mental health and on the NCLEX. Okay, these are NCLEX style questions to help prepare you for the big thing, which is the NCLEX. Okay, so the great thing about that, I love the fact that you're able to customize the style questions and really hone in on mental health and the different types of questions strategy wise for mental health. Okay, little tidbit, I'm telling you, this is important. I am not paid, sponsored, or anything. I'm just telling y'all what works for me and worked for over like 15,000 people. Okay, I've helped over really 30,000 at this point get through nursing school and gave them the same advice. I'm telling you. I am telling you. All right, now let's go ahead into the actual things that you really need to know as far as mental health. Content wise. 1 second, let me pull it up. Let me see what y'all saying. Taking mental health now. Oh, future learners, you're taking mental health now. Perfect. So this is a perfect review for you. Okay. All right. So some of the main things. Oh, I already have it up, and that's why I pulled it up. Some of the main things that are always and commonly tested when it comes to mental health, both on your chapter exams and on the NCLEX, is defense mechanisms. Defense mechanisms. All right, right here. Every time I look, there's a different number of defense mechanisms. I'm not sure how many you guys learned. Let me know below. Comment how many defense mechanisms you learned. I learned 17. When I looked, it was like 20. When I looked at it again, it was like 14. So it like comes, I don't know, the number changes. It's like the rights of drug administration. There's always a different number. Okay, so this one's 17. So these are the 17 at least common defense mechanisms, right? And this page is included in the my mental health study kit that I was telling you guys about, the Scooby-Doo one. All right, so these are defense mechanisms. I did it like it was like a Scooby snack. All right, this is Scooby snack box right here. But these are the different like defense mechanisms name-wise. These are the actual examples and definitions. Now, these different defense mechanisms, definitely something that you want to star, highlight, whatever, and focus on when it comes to studying. Defense mechanisms and coping, but let's go through defense. Okay? I don't know if y'all can see that. Boop, boop, boop. All right, so first one is compensation. All right, the description of that is trying to make up for a deficit by focusing on something else they consider more desirable. Okay? Compensation. All right? It kind of like sounds like when well, here's an example. Like the Napoleon complex, which is when like a shorter man is acting like overly aggressive to seem bigger, right? That's the Napoleon complex. Yeah. Ladies, have y'all ever met a man with a Napoleon complex? I hope not. Save yourself. But yeah, it's super cocky. But yeah, they're trying to compensate for that lack of height, okay, with their attitude. They're trying to have a big attitude, even though they're about 5'1". They're trying to have the attitude of someone 6'10". No. Chill. All right, so that's compensation. Next one is denial. All right, I think we're all familiar with denial. Okay, the description of this is avoiding reality by ignoring and refusing to acknowledge it. I'm in denial right now about the fact that I have not gone to the gym, not once, since October. I'm in complete denial about that. All right, that was my example. Another example is a husband whose wife has terminal cancer is still hoping for a cure. Thank you. Oh, thank you for your future ER nurse. I was just about to say it. Denial is very important when it comes to like addiction. All right. So when you guys get into the addiction phase of mental health and you start to get questions surrounding that, you'll quickly realize that a lot of them will be based around like denial. Remember, denial is the first step in something. But that's usually like any type of addiction rule step program. Denial. All right, you got to get out that denial in order to accept help. Who in here is in denial over a man? The 12 steps. Who's in denial over a man? Avoiding reality by ignoring and refusing to acknowledge the fact that he be texting that girl when you go to sleep. Denial. All right, next thing we have displacement. All right, this is shifting feelings onto something or someone else. All right, ignore this example. An example, this is a typo. An example would be like kicking the dog syndrome. Like when, like a husband had a rough day at the office and then comes home and kicks the dog. It's taking that aggression out and transferring that onto another subject, on something else. All right, sometimes kick the dog, sometimes something else, somebody else get it. But like, yeah, taking out that aggression on someone's face, that's displacement. Okay, dissociation. It's temporarily blocking memories and perceptions from consciousness. Okay, an example would be an adolescent witnesses a shooting and is unable to recall any details of what happened. All right, that person is dissociating themselves from whatever memory. All right, they're trying to separate themselves from that specific memory, which is usually like a painful memory. Okay, PTSD, absolutely. So just like with denial is big with addiction, dissociation is big in PTSD. All right. Next thing, identification. Attempting to become so much like another person by mimicking their mannerisms. Okay. An example of this is pretty much just being a copycat. Just being a copycat. All right. Remember in Mean Girls when they were like, Regina George wore army pants and flip-flops, so I bought army pants and flip-flops. Do you remember that part? That's an example of identification. They're trying to identify with another person by, in this case, dressing like them. All right, that's an example of mimicking their mannerisms. Or if someone like tries to talk like another person in order to, once again, model themselves after that person. That's another example of identification. All right. Intellectualization, trying to find rationale or logic to avoid negative feelings. All right. An example would be a person with a newly diagnosed disease focuses on surviving rather than dealing with their emotions. All right. Next thing, introjection. Typo. I don't even think that's a typo. I think it's just a sizing issue when I saved it. Introjection. Incorporating another's beliefs and values into your own. All right, this is important in forming the conscience. All right, an example would be a little boy tells his friends not to say shut up because it's a bad word in his house. All right, incorporating another's beliefs and values into your own. All right, that's pretty much how. But as far as when it says important, informing the conscience, like wrong or right. Next thing we have is isolation, separating your emotions from a thought. All right, an example would be a medical student dissects a cadaver without being disturbed by thoughts of death. Separating your emotions from thoughts. That is very common when it comes to nursing. All right, a lot of times nurses, we have to isolate our emotions. That's what they call, leaving your baggage at the door, leaving your emotions at the door, checking them at the door, whatever the girls say nowadays. But especially when it comes to, nursing, because it is life or death, a lot of times we experience loss, we experience death. And in order for, that nurse not to break down right then and there and to keep it together and still be able to administer care, they have to isolate themselves and separate their emotions from that specific thought. Get it? All right. The next one would be projection. All right. This is attributing one's thoughts to another person. An example, a student blaming her failing exam grade on the teacher. For not teaching the correct things. All right. Projecting. You project your thoughts onto another person. All right. That's like in every romantic comedy movie ever since like 2016. All right. Projecting on to somebody else. It has nothing to do with it. All right. Next thing, we have rationalization. All right. This is attempting to justify or modify unacceptable behavior to prevent guilt. All right, this is the justification part. We try to rationalize and give a reasoning for someone else's behavior. This is a woman's justifying her husband's infidelity by explaining that he's been stressed. All right. Oh, he's been stressed. Like, what's that Destiny's Child song? Girl, talk to you. Y'all know what I'm trying to say. That song, girl, that's rationalization. Next thing, reaction formation, demonstrating the opposite behavior from how you feel, aka being fake, being two-faced. All right, being overly nice to someone that you clearly don't like. All right, that is the mental health version of saying, girl, you are fake. Reaction formation. All right, so next time you want to subtly shade somebody, just say reaction formation. Next thing is regression. All right, that's retreating to an earlier level of development. An example would be children sucking their thumb or wetting the bed when a sibling is born. All right, that's usually like traumatic, especially with only children. Yeah, that new introduction and that taking away of like all the attention, they're going to then retreat back to the earlier days or an earlier time when they were getting that attention. Okay, maybe if I wet my bed and suck my thumb, they're going to, you know, come back to me and pay me all this attention before, like they did before. That's an example of regression in the eyes of a toddler. Okay, next thing is repression. All right, please do not get regression and repression confused and mixed up, because they will play at that G and the P. They will play on whether or not you can see the difference. All right, repression is involuntarily forgetting painful thoughts and feelings. This is our primary ego defense. All right, examples: a woman is unable to remember being sexually abused as a child. All right, if you've ever watched Law and Order SVU, there you go. That's most of the victims, especially if, once again, it's actually sexual crimes. They don't remember what happened because that defense mechanism, they're trying to protect themselves from that hurt. They're going to repress that memory. Next defense mechanism we have is splitting, viewing people in situations as as all bad or all good, unable to integrate positive or negative attributes of self. This one's always confusing to me. But an example would be someone loving who you are one day and then hating you the next day. Okay. If any of these, and this is a study tip, all right, for mental health, if any of these defense mechanisms, maybe you don't get the example, put a star, write it down, whatever, and just go look up an example that works for you. You know, something that you can associate with maybe a past memory of yours that's going to help you retain and recall it at a later date. But you have to do whatever, you know, works for you, especially example-wise, just to make sure that you understand the difference between these different defense mechanisms. Next one is sublimation. Channeling unacceptable drives into something more socially acceptable and constructive. An example of this would be a man channeling his anger and physical aggression through football and boxing. All right, and then our last one. I think we have two more. This one is suppression. All right, not regression, not repression, but suppression. This is intentional excision of thoughts and material from consciousness. All right, this actually may lead to repression, but it's not the same thing. Remember, repression is the involuntary forgetting of whatever event. Suppression is that you do it on purpose. You are purposely stuffing that memory down and into the back of your emotional closet. You're suppressing it. Okay, so suppressing is intentional. Repression is involuntary. Okay, now an example of suppression is a nursing student thinking about upcoming exams while away on vacation and decides to worry about it after. All right, they're intentionally saying, you know what, let me just be in the now and enjoy Mexico, and I will intentionally put this thought on the back burner so I can enjoy myself. Understand? All right, and then, was that the last one? No, this is the last one, I think. Last one is actually undoing. This is our 17th defense mechanism. Undoing, the description is performing an act to make up for prior behavior, as if that act would undo, get it, undoing, would undo that past behavior. An example, a friend who forgot your birthday but buys you tickets to the next Beyonce concert. To make up for forgetting your birthday. Now, this don't say nothing about whether or not you forgive said friend. Now, where are we sitting? You know, there's some things that, can we answer a little bit of some questions, all right, to see if this undoing really, this has undone you forgetting my birthday. I'm just kidding. But undoing, that is the 17th defense mechanism, all right? And when you think about defense mechanisms, let the name help you. Defense mechanisms. All right. Different ways to defend yourself from unpleasant feelings, thoughts, pain, memories. All right. So this is your body's natural way of defending itself against painful inflictions. Okay. All right. Once again, this is within the bundle. This is within the mental health study kit, which once again you can get in the Ultimate Nursing School bundle, the 3rd semester bundle, and the brand new Trick or Treat study kit. All right, and that goes over care plans, diabetes, and mental health was thrown in as well. Okay. Next thing that you guys should definitely know, and I want to go through defense mechanisms because I want you guys to really understand the difference between the two. But let's go ahead and go into, you can't even see that. I'll read it. The next thing that you should definitely know, as far as concept-wise, topic-wise, is communication techniques. Okay, one of the communication techniques is called therapeutic communication. All right, and then inversely, you also have non-therapeutic communication. So that's like the stuff that you're not gonna do. All right, that's not gonna be the way to effectively communicate with somebody. All right, but conversely, therapeutic communication, we're all good. We all good in the hood. Okay, this is how they want you to really speak to all patients, but especially mental health. And we're going to get into why it's so important to understand who you're talking to when trying to decide what you're going to say and how you're going to say it. Okay. One second. All right, so yeah. So the therapeutic communication, there's like different like techniques here, and in the actual study kit you can see it more closely, but we're gonna go through at least the like a few of them so you know what kind of examples I mean when I say therapeutic communication techniques. Okay, using silence. All right, that's an example of a therapeutic technique. Sometimes it's best when you just don't speak. All right, sometimes, like I said, it's just useful to just not speak at all. Silence the deliberate silence, all right, that can give people time to, think about what's happening and then process what they're supposed to do next or what's supposed to come next. All right, so silence is a great way to therapeutically communicate with the patient. All right, when it comes to accepting, another one's accepting. Let me see if I see it here. Yeah, number 9 is accepting. All right, that is basically acknowledging what the patient is saying and like almost like confirming that you hear. So like that's why example here you see like yes, yes I understand. Okay, those are different ways of saying that yes I hear you. I hear you. Okay, that's another type of therapeutic communication. Another one, does anybody know another one, or you just want me just to go through it? Can anybody say, I tried making it bigger. That was really me. Oh, not me. Yeah, I tried to make it bigger, but it wouldn't let me. This is as big as it that it got, unfortunately. But once again, if you want to see this better and have it at your fingertips, make sure you at least get the NCLEX Trick or Treat if you don't have the Ultimate Nursing School bundle. Okay, another one would be active listening. I see what happened next. Y'all know what y'all be saying when y'all be trying to act like you're listening, but you're whether you are or aren't. But those confirmatory like nods or like little bits of words that once again lets them know that you're actively listening. Yes, and engaging with what they're saying. Active listening is an example of a therapeutic communication. Seeking clarification. I'm not sure I understand. Yes, it's in the bundle. Absolutely. It is in the bundle. It should be towards the end. In the third semester section. Another one would be summarizing. Summarizing is really big when it comes to therapeutic communication. Okay. After they tell you something, after they tell you a fact, you might have a question that's like, what would be the most therapeutic thing for the nurse to say next? And it would be, something that's summarizing, right, what they're saying. And it's like, y'all know what summarizing means. Like, you're basically saying it and like you're rephrasing it and saying your own words. It's like, so you're saying that da 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 da. Or you repeat what they say and it's like, does that sound like, is that true? Does that sound correct? That's summarizing. All right. The best way I would say to really understand therapeutic communication, because you can read these all up and down and they're great to kind of like refer back to be like, okay, what does this really mean? But when it comes to actually like learning how to pass mental health and NCLEX questions or about mental health, the best thing I would recommend is actually taking those practice questions, those mental health practice questions, because then you can see how to prepare. You can see how they're going to, the type of questions and the style that they're asking you the questions. That's honestly the best way to get a good gauge of what to expect when it comes to questioning, because you'll never get the exact question. You'll never get the exact question, but you'll either have that exact content. If it's something about therapeutic communication, it's going to be about therapeutic communication, but they could easily switch any piece of information to really still assess whether or not you comprehend mental health and therapeutic communication. See what I'm saying? So the best way to get around that is to incorporate repetition. All right, you got to repeatedly expose yourself to these practice questions, because by then, after a certain time frame, and after you've done however many it takes for you to realize this, but you start to see a pattern. Okay, you take enough practice questions, in which you should. You'll start to see a pattern in the content that they definitely like emphasize and repeatedly ask. Doesn't matter like who you are or what your credentials are going to be. There's specific things that they definitely want you to know, and it's going to be on in some way, shape, or form. It's going to be on someone's NCLEX in some way. And once again, as you take several different practice tests, practice questions, you'll start to notice a trend. And I can attest to that because I've been doing NCLEX Jeopardy almost every week for about 2 years. And, with the categories being mental health, fundamentals, pharmacology, blah, 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 I can tell you the stuff that they really look for with like my eyes closed, which is why I felt compelled to do this live and really tell you guys and kind of like try to go through what they definitely emphasize when it comes to content in mental health. Okay, so that's an example of the therapeutic communication sheet table within the mental health study kit. So that's really how it looks. All right, so let me go ahead and let's just go back to ignore that link. But this is, I just want to just bring this to you guys. But yeah, so therapeutic communication is something that you definitely need to note. So jot it down in whatever notebook. If you have the bundle in mental health, it's already there for you. Everything in the bundles, things that you should definitely know. Okay, but let's go. I'm just gonna finish listing other things that you definitely need, and then I'm gonna give you guys like a sample question when it comes to mental health. Okay. All right. So I already said defense mechanisms, therapeutic communications. Know your psychosocial assessments. Know your assessments that are going to be like your psychiatric assessments. All right. And there's like, just like with any system in the body, you know, your mental health is also a system. Okay. So the way that you assess it is pretty standard every time you have like a mental health patient, or you go through the mental health section of any type of assessment or exam. All right. They're usually called like mental status exams. And that's usually when you're trying to identify like their present mental state. Are they alert, oriented? You know, that stuff. You also need to know like body image alteration is a part of it. So you need to know, you know, body image can lead to a lot of, oh, you're welcome, Erica. Body image can lead to a lot of mental health disorders. So this is a category of its own. All right. So anything that can happen to our exterior can affect here, how we see ourselves, how we see life. You know, how many times have you heard a story of someone that, you know, got into a car accident and now they're like a quadriplegic or a paraplegic, and they like their mental health because of it is gone to shit. Right, exactly. So that's a body image disturbance. So make sure you know the 5 different types of body image disturbances. You need to know like the feelings about like cancer, ostomy, as far as body image, like the feelings about ostomies, right? Pregnancy, cancer, like amputation of a limb. You also need to know personality disorders. Okay. There's like, I learned 10 types of personality disorders. I'm not sure if the number is still the same, but there's like 10 different types of personality disorders. And examples of that is like narcissistic personality disorder. Okay. Narcissists. All right. Grandiosity, need for admiration, lack of empathy, classic narcissism. That's a personality disorder. Okay. Another one is borderline personality disorder. All right. That is like a marked impulsivity, instability in interpersonal relationships. Another one would be schizoid personality disorder. All right, that's the detachment from social relationships and an actually restricted range of emotional expression. Another one would be obsessive compulsive personality. All right, that is OCD, basically. That is a personality disorder. It's a preoccupation with orderliness, perfectionism, and control. That control is like that is definitely like a hot word, like a buzzword, control. Because when you think about OCD, a lot of people think about just cleaning, and it's not just cleaning. And you'll get examples where it's describing OCD, but it's not describing the need for, you know, cleanliness. It's describing, they may or may not be clean. More than likely they're going to be clean, but the specific example is going to, you know, accentuate their need for control, their need to be in control, their need to have order. You know, they're going to describe that, and you got to be able to still associate that with obsessive compulsive disorder. It's not just cleanliness. Okay, star that. Those are just examples of personality disorders. So we'll talk about that. It explains it a little bit more into detail when you get into the bundle. All right, we went over the 17 defense mechanisms. Psych disorders. Okay, these are well, what you do, it says modify approaches based on the patient's developmental stages. All right. These are psychiatric disorders based on development. Let's just say that. All right. An example would be something called intellectual development disorder. Okay. Down syndrome is an example. Okay, that's also called extra chromosome 21, aka trisomy 21. Another example would be attention deficit hyperactivity disorder, or ADHD. Autism is another one. Separation anxiety disorder. Okay, that's usually for pediatric patients. A lot of times, if you have like a younger pediatric patient that's been diagnosed with separation anxiety, it's usually like manifesting, and you'll see this in the questioning, so that's why I'm saying it. You'll usually see them like hugging onto mommy or daddy's like leg, you know, when they're being dropped off at daycare. Okay, they're like, no, mommy, I don't want to go. That's usually how you would see that explained in a question. But it's basically excessive distress whenever they're away from their parents. Okay. Know what disfluency is, enuresis, and encopresis. Know those three things. That's a part of like one of the psych disorders. And this is once again like really more so in like peds. You guys know what like disfluency is? It's stuttering. Know that. Because I had a question where it didn't say stuttering. It said like diagnosed with disfluency, or a patient with disfluency. I had no idea what disfluency is. Disfluency was, but it's stuttering. Okay. It says often absent when talking or singing. Okay, the question won't be like, what is disfluency? It's not going to be, that's not what the nursing school questions are going to be like. It's way too easy. It's going to have something where it's, you know, incorporating like your knowledge of disfluency, right? So that note that I just put there is because I see it time and time again. All right. Disfluency or stuttering is often absent when talking or singing. So the question you would usually get is something where it's maybe like patient education. It's like, which one of these, when repeated back to the from the patient back to you, would let you know that they have a good understanding of disfluency. And they'll list options, and one of them would be, it's often absent when talking or singing. That's an example of a question that you would get. Okay. Next thing you need to know is enuresis. You need to know that enuresis, ENURESIS. Does anybody know what that is? Enuresis. This is usually noted in pediatric patients. No. Enuresis is bedwetting. ENUR, right. Thank you, Dior Brat. It's bedwetting. Okay. Now this is what I usually see. These two tips really quick. This is what I usually see as far as them making sure that you comprehend your important nursing interventions when it comes to enuresis or bedwetting. You need to know that you like expect for them to, if it's bad, administer imipramine. Hold on, let me see if I can type it because I know I butchered that. Imipraline. Let me see if I can do it. IMIPRAMINE. That's the medication. That's the medication that's usually administered for bedwetting. All right. Something else that you will usually see more than the imipramine, but I just want to just let you guys know that too, is that something that parents can do, or the children should, or whoever it is can do to lessen the bedwetting, lessen the enuresis, is no fluids before bed. Okay. A lot of times the questions that you'll get surrounding that would be, once again, like patient education questions. A lot of mental health is about patient education. Okay, what do you know about like the nursing intervention wise and nursing wise about these individual like psych disorders, right? We can't prescribe nothing. We can't, we can't do any of that. All right, but what we need to be able to do is assess for signs that may look like either a certain pattern that indicates a disorder, as far as like assessment wise, but as far as like intervention patient education wise, we need to know, once again, like how these things look, what they can expect, what's normal versus, not normal, like expected versus expected side effects, what they can do to alleviate some of those side effects or adverse reactions. What's an indicator of like a complication, or what is a complication, and what do they need to know about it? Like, what's the first thing they need to do? If it's like inpatient and that complication comes up, what is it that you need to do as the nurse priority wise? That's the type of questions that really you're going to see all through nursing school, but especially in mental health, because once again, you're not assessing for something as visually obvious. Okay, you're not assessing for, that has a large scar down the right arm. That's not what you're assessing for. It's not really a physical thing. It's a mental assessment that you're making, and that requires really talking to, right? You can't know what's inside someone's head without them telling you in their own words what it is. But it's up to you as a nurse to decipher that and still be able to communicate with them, to get more without like scaring them, causing them harm, or causing them to shut off and not tell you anything. So those are the things that you need to focus on whenever you're going through mental health, your whatever study guide you use. As you're reading through, you need to keep that, right? You need to keep that in the back of, not even the back, you need to keep it in the front of your brain. Okay, like, how can I use this as the nurse to prevent? Remember, the theme of the NCLEX is patient safety, I believe. So everything that you're doing needs to be around not causing any harm to that patient. Okay, whether that's them feeling bad about themselves, because once again, this is a mental health thing. So when it comes to, causing harm to that patient, it goes a little bit more deeper than, slipping and falling. All right. You have to worry about now their mental health, like they're causing mental harm, causing them to feel bad about themselves, or, feel shame or anything like that. Now that's what you now have to incorporate into mental health. Okay. A future ER nurse said that's why therapeutic communication and nonverbal cues are so important. Absolutely. Absolutely. All right. Sometimes they won't tell you what's going on, and you have to be able to visually assess and observe for behavior patterns, if it's anything physical, like, are they disheveled? Like, do they look well groomed? Those are the type of things that you need to be like attuned with. All right. The next one is encopresis. That one is fecal incontinence. So just like how enuresis was bedwetting, all right, encopresis is fecal incontinence, pooping the bed, pooping themselves, whatever you want to say. All right. What you want to do as far as, or what you want to remember as far as nursing education goes, is that you want to tell the parents to help that child establish a poop pattern. Okay? Establish a poop pattern. Let's get them on a poop schedule, if you will. All right, next thing they should do is, if that child is pooping deliberately, okay, if it's not like a medical condition that's causing them to, maybe their anal sphincter is loose, I don't know. But if it's like they're deliberately squatting down and like taking a crap in your kitchen floor or something like that, if it's deliberate, then what you want to do is encourage the patient, the child, to express their feelings. Get them to, tell you pretty much why they're doing it without you asking why. Okay? So encourage them to express feelings. That's a way to therapeutically communicate to that patient, especially of that age group. So they can tell you in their own words how they're feeling, which led to them doing whatever action. Okay? Eating disorders. Eating disorders. You know the difference between anorexia nervosa and bulimia nervosa. Okay? Y'all know the difference? Anorexia nervosa and bulimia nervosa. Which one's life-threatening? Which one is between anorexia and bulimia, which one's life-threatening? Anorexia or bulimia? A or B? Anorexia is A, bulimia is B. A or B? Which one's life-threatening? Come on. Comment down below. I know y'all know. Dior says A, which is anorexia. Erica says A. Jazz says A. Right. So the life-threatening one is anorexia. Absolutely. It is A. Okay. I was about to say, wait, hold on. So this is very important. You need to know this, whether it's mental health or honestly anything in nursing school, because this is a very important, strategy for the NCLEX. And in turn, it's going to be a strategy for your nursing school exams. All right. You need to know why. Not just for this question, but whenever you have a question like this, where it's, when you're having to, you need to know why about everything, honestly. If you have a question, and whether it's straightforward or not, you need to know why you chose that answer. Now, if it's because you guessed, at least you know that you guessed and you really don't know the why, but you need to do some studying and research, put a star next to it so you can fill in that why. You need to know why. Okay, on the next NCLEX on April 1st, 2023 and on, you're going to have questions where it's going to be two parts. And one's going to be, for you to just pick that answer, whatever. And then the second part is going to be your reasoning, or not your reasoning, but the reasoning as to why that's the answer. Like, for example, it'll be like, as far as anorexia, bulimia, between anorexia and bulimia, anorexia is life-threatening because, and the answer would be, as far as why it's life-threatening, because it can lead to refeeding syndrome, which can lead to cardiac collapse. Okay? Did you know that? I didn't. But it is like in my book, it is like in red, it says NCLEX tip. Make sure you know this. So that goes to tell me that this is important. Y'all need to know this. So you need to know that anorexia is life-threatening. And why it's life-threatening is that it can cause refeeding syndrome, which can cause cardiac collapse. Okay? Do y'all know what refeeding syndrome is? Whether you do or don't. If you don't know what it is, it's the perfect time to Google it. Google is free, open 24/7, 365. Boop, 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 just a little type. Just look it up really quick if you don't know what it is. Future ER says yes, getting too many calories at once. Yes, pretty much. It's that fatal, it's like a shift in fluids. It's like shock, basically. You doing too much too soon, too much too quick. That's basically what that means. All right, especially if the patient's like malnourished. I think I saw somebody say that. They're malnourished because, those you feature your nurse. So they're malnourished because they're not eating at all, and then all of a sudden, getting food, all those calories can cause the system to go into shock, basically, and that causes the cardiac collapse. It just gives up, basically. It belongs too much, overwhelmed. It gets overwhelmed. And it says give up. So that's why anorexia is life-threatening, all right? Make sure you know that. The book told me, so I'm telling you, know that. All right? What you definitely need to know about anorexia is... oh, I see this a lot. That absent periods are big when it comes to anorexia. Like them asking you anorexia questions. Like I'll see, and I've seen this personally and on like NCLEX Jeopardy and other people telling me, oh my God, I did have a question about that. You'll have a question, it'll be like, you know, a client comes into you, 17 years old, I'm 22, whatever. Let's say 22, I feel better. 22 years old, weighing 105, like their BMI is like super shit, and they also tell you that they have not had a period in however long. Like they've had absent periods. You notice absent periods, or it's called amenorrhea. Amenorrhea, so absent menstrual cycle. All right, so if you see absent periods, amenorrhea, think of anorexia. They all start with A. AAA, and I don't mean the car service. Anorexia equals amenorrhea equals absent periods. So think about that. Absent periods equals anorexia. All right. Somehow, in some way, however they structure the question, they question you about that. Okay. It's usually a type A personality. Their electrolyte, they're malnourished, so their electrolytes are off. Make sure you know the manifestations of a client that is that has malnutrition. Okay. And what I mean by that, as far as manifestations, not like super skinny. I mean like, what are their labs? Are they increased, decreased? Which ones are increased, decreased? How are the electrolytes? You know, blah, blah, blah. That stuff. Bulimia, all right? When you think about bulimia, think about binge eating. B for B, all right? It's helping us. A, anorexia, absent periods, and then B, bulimia, binge eating. Okay? All right, you need to know that they're happy when they're eating and they're sad when they stop eating. Okay? So, make sure that those two little nuggets lets you know that you need to pay attention to their like emotional assessment. Like, how is their affect? Okay? If they are, you know, grumpy all the time and not eating, but then happy when they, you know, are eating, that is a common sign. It's a common manifestation. All right. They vomit afterwards. This is really important. When they're vomiting, okay, the stomach acid from those from the digestive juices and the digestive contents and stuff, that causes tooth erosion. All right, tooth enamel erosion specifically. All right, so you can, if their tooth enamel is eroded with stomach acid, like imagine putting like battery acid on someone's teeth. So if you look at somebody and you see pristine, let me not say that, but if you look at somebody and you see jacked up teeth, that can help you as far as trying to figure out if they, you know, are showing signs of bulimia or anorexia. Okay, you would expect for anorexic patients to have better teeth. Well, just in the way that it's not eroded. Okay, it don't look like meth mouth, sad to say. All right. Another thing for bulimia, Russell sign. Russell, like almost like Russell Crowe, but minus the crow. Russell sign. It's bruises on the hand from self-induced vomiting. That's another like physical manifestation. So when you're doing your assessment, you notice jacked up teeth. You notice Russell sign, which is the bruising on the hands due to self-induced vomiting. That's two checks, two strikes. I'm letting you know that this person could possibly be bulimic. Okay? Make sure you know those. You need to know about neurocognitive disorders. The two that you definitely need to know the difference between, and I see like these are like great select all that apply questions. I see these all the time as select all that apply questions. The difference between delirium and dementia. Please know the difference between delirium and dementia. Okay. It is, yeah, it's a little list, but you just need to know the difference, especially for the select all that apply questions, because it's not like you can just, oh, let me just guess one. No, you gotta know at least the difference so you're able to choose whichever ones apply to whatever they're asking about, whether it's delirium or dementia. Okay. Wait, hold on. Can I do this? Okay, I tried to do that. Is this a joke? Hold on. All right, so really quick about delirium dementia. Let's see what you guys know. All right, just what do you think? Which one would be more of a rapid onset, delirium or dementia? Which one comes on quicker than the other, delirium or dementia? Which onset is rapid, delirium or dementia? Delirium, right. Delirium's onset is rapid, all right? Think about getting delirious, all right? That's usually a part of like an altered mental status, like acute confusion, okay? That can happen for, if they have a UTI, who knows? But that happens quicker and at a more rapid onset than dementia, which is gradual, okay? With delirium, you'll have abnormal vitals. With dementia, you'll have normal vitals. Delirium is reversible. Dementia is irreversible. Okay. When you think about manifestations, think about like if you have someone that has more of a personality change, then that's more dementia. Okay, and dementia is actually, this one's important, dementia is the most common form, the most common form of dementia is Alzheimer's. Okay, so that's something else that you definitely need to know. Alzheimer's. All right, the 5 A's of Alzheimer's disease. You didn't know the 2 types of like Alzheimer meds, cholinesterase inhibitors, like donepezil, and NMDA receptor antagonists like memantine. All right. You need to know the side effects of those medications. You need to know what you need to monitor. So for the NMDA receptor antagonist, the memantine, you need to monitor renal function. Okay. You need to monitor renal function in that one as opposed to something like donepezil. That's more, it's better tolerated, which is why it's usually the most prescribed. But also be sure to know, I see this a lot in patient education and just making sure that the client understands their diagnosis or the purpose of these drugs. You know, those 2 Alzheimer's, 2 types of Alzheimer's meds. Know that those drugs do not cure Alzheimer's. All right. It does not cure the dementia. It does not cure Alzheimer's. All right. They help slow down the progression, but it does not cure it. All right. And that's super important. Like I said, especially when it comes to patient education. Yeah. So you'll get a lot of like, which one lets you know that further teaching is needed? Which one lets you know that, they have a good understanding of their new diagnosis? Be sure to just pay attention strategy-wise. Be sure to pay attention to that type of question so you know what it's really asking you to answer. All right. Know like the different types of stressors. When we think about stress, it's not like life is stressing me out. Like it's like actual, like there's a physiologic type of stress, there's a psychosocial type of stress. So when like life is stressing you out, that's psychosocial. That's like life crises. It's usually situational, like my car payment is late or something like that. I don't know. That's like a life stressor, right? And then as opposed to like a physiologic stressor, that would be like COVID. That would be the flu, something that's stressing your body. All right. Know the difference between the stress responses, like fight or flight, and like the sympathetic, parasympathetic stress responses. And with that, like the fight or flight, make sure you know how that looks. Okay. That's, like I said, you need to know how something, like the manifestations about something, especially within like mental health, because it's not like a physical ailment. So you have to look at the physical clues instead and put them together. All right. So somebody that's in an actual flight or fight response, they'll have, like their pupils will be dilated. They'll have cold and clammy skin. They'll have rapid, shallow respirations. Their pulse and blood glucose will be high. Like those are physical clues that are hinting towards, somebody exhibiting signs and symptoms of a client that's in fight or flight, or the sympathetic adrenal response. Okay. All right. You also need to know the stages of stress, or the general adaptation syndrome. You need to know about anxiety. So when it comes to like anxiety, there's different levels of anxiety. Just like how there's like different levels of hypertension, there's different levels of anxiety. You have mild, moderate, severe, panic. They're like Taco Bell hot sauces. All right, you have different levels. Okay, you have the orange, the yellow, the red orange, and the fire hot orange. Okay, mild, moderate, severe, panic. All right, and just like it sounds, that describes the level of anxiety. Okay, no anti-anxiety meds. Okay, usually with anti-anxiety meds, they are benzos, and we're able to identify the class benzos because it has what suffix? Benzodiazepines have what suffix in common? When you're looking at the name, what suffix do they have in common? Benzodiazepines. No, not peens. Benzodiazepine is a class of medication. What is the suffix of the different types of medications? No, it's not "-ine". Benzodiazepine. All right, benzos. Anti-anxiety. Your PAMs. I'll say it. Your PAMs. Like alprazolam. Okay, that one's lamb, but usually they're PAMs. All right. Alprazolam is like is Xanax. Okay, that's the black sheep, but it's PAM. All right, the next one is usually diazepam, lorazepam, clonazepam. That's him. Midazolam. That's not a PAM, but AMs/PAMs. Those are going to be your benzodiazepines. And you'll probably, like the most commonly prescribed ones, alprazolam, clonazepam, diazepam, and lorazepam. Okay? Yeah, that's what I'll say. All right? Make sure you know the side effects of those. All right? And also make sure you know the overdose reversal agent of benzodiazepines, which is flumazenil. All right? Flumazenil is what you use in patients that overdose with benzodiazepines. Okay? And benzos are a controlled substance. All right? There is a non-benzodiazepine type of anti-anxiety, and that's buspirone, which is Buspar. That one's not controlled, and that one's usually for a shorter term of use. Okay? Know the side effects for those. All right. I think we were talking about addiction earlier. Yeah, I think we were talking about addiction earlier. So, kind of know the common behavioral patterns of someone with an addiction. Know nursing interventions when it comes to those behavioral patterns. Like if they're violent, if they're aggressive, if they're like regressing. Remember, regression is a defense mechanism, right? Know how to therapeutically communicate with someone that's in that state. When it comes to like priority interventions, immediate interventions, when it comes to like mental health situations, your priority is going to always focus on control and safety. Okay, getting control of the situation and making sure that you, your patient, and everybody else is safe. Okay, that's going to be your focus, your priority focus. Your immediate intervention is going to be the focus on controlling the situation and safety. All right, after that, it's going to be followed by a discussion. It says to alleviate guilt and to help identify those behaviors so you can prevent future episodes of whatever aggression. Okay, so when it comes to someone that's angry, whether that's from addiction, whether that's an angry patient, period. They could be angry because this is a true story. I had a patient that was angry and walked around like he was going to punch somebody in the face because he didn't like the color of the clock. Real rap raw. That's a true story. All right, so you have to know how to de-escalate, all right, an angry patient. Someone said, do you like UWorld? Me personally, no, because I am a very visual person, and I kept falling asleep with UWorld. Like, I found out that I'm newly ADHD, or I found out that I'm newly ADHD. And my attention span for the way that they have their questions and like the format, I just couldn't do it. It doesn't work for me and my learning style, and that's fine. No shade to them. It's worked for a bunch of people. It just doesn't work for me. It does not work for Nurse Sam. So I had to use something that's a little bit more colorful. So that's why I created NCLEX Arcade. But yeah, back to what I'm saying. So you need to know how to de-escalate and communicate with the patient in order for you to de-escalate a situation where you have an angry patient. Okay? Once again, number one, focus on getting control of the situation and making sure that you, your patient, and everyone around you is safe. Follow that by a discussion to alleviate guilt. So that's why a lot of times they're like, you're not in trouble, especially if they don't do anything, they're just angry. Let them know that they're not in trouble for, like having a reaction, being angry, blah, blah, blah. I don't know what else y'all gonna say. Depends on, the patient and the different factors or whatever. But you want to, have a discussion that alleviates guilt. And whatever that looks like for that patient, that's what you want to do. And then next thing you want to do after that is you want to identify behaviors to help prevent future episodes of that anger. So whatever cause, like that primary cause of whatever it is that angered him, especially if it's situational. If it's not, then identify like the cues that lets us know like, okay, this is gonna anger me, or this person's about to be angered. So you know how to diffuse, de-escalate, and maneuver the situation. Okay. When it comes to like, well, in the book, it's not really called like addiction. It's called substance abuse or dependence, right? It depends on what it is. Oh, get it? Da, 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 da. So, substance use disorders, that's what they call it. You have your alcohol dependence. This is very important because you will oh my gosh, I can't tell you how many questions I had about, like alcohol. Someone being addicted to alcohol or going through withdrawals. That's like, that's on like every NCLEX ever. Okay, you need to know the alcohol withdrawal symptoms. And then even more importantly, you need to, well, I'm going to say just know both, okay? You need to know the alcohol withdrawal symptoms, which is like anorexia, irritability, tremoring, they call it tremulousness, insomnia, nightmares, and hyper-alertness. Those are the symptoms of alcohol withdrawal, all right? Take it a step further, you need to know the symptoms of alcohol withdrawal delirium, all right? This is when it starts to become like life-threatening. You get like DTs or delirium tremens, all right? The onset is usually 24 to 72 hours after the last drink. Is that what you said? See, this one says, well, probably alcohol withdrawal, but the actual withdrawal delirium, the delirium sets in within 24 to 72 hours after the last drink. So that's very important for you to know, because a lot of times you'll get a question that'll say like, it'll be during like an assessment, and you'll be like, you have a patient that's coming to you, I don't know, for alcohol withdrawal and whatever, alcohol withdrawal. They let you know, or you find out during your assessment, that their last drink, or the patient says that their last drink was 1 day ago, or 2 days ago, or they'll say it in hours, or 24 hours ago, whatever. Maybe they'll say 12 hours on the actual exam. But what you need to know, what they're actually assessing, is that you know when to expect, after the certain amount of time after the last drink, when to expect the alcohol withdrawal delirium to set in, which is different than alcohol withdrawal syndrome. All right. It starts to become life-threatening when you develop DTs or delirium tremens. Okay? See, Future Earner said, yep, definitely had that on my last test. I'm trying to tell y'all. All right? Next thing you need to know, oh my God, I got this question all the time. And it's on like every practice exam for NCLEX Jeopardy, I swear. Wernicke encephalopathy. Wernicke's encephalopathy. All right. That is, it's an acute and reversible neurologic disorder. All right. It's usually accompanied by a triad of symptoms, which is global confusion, which is funny to me. But anyway, global confusion, ataxia, which is like loss of coordination, unbalanced, and then nystagmus, which is like rapid eye movement back and forth, and or abnormality. And all of that is symptoms of B1 deficiency or thiamine deficiency. All right, so you need to know that B1 is thiamine, first of all, because they will use it interchangeably. One day they'll have they'll let you know that it's maybe 100 milligrams of vitamin B1, but you got to know that B1 is thiamine, which is what the treatment would be for Wernicke encephalopathy. All right, since it's a thiamine deficiency, the treatment would obviously be to add some thiamine back into it. Okay. Oh, see, Future Yarner said, yep, B1 deficient. Okay, so you need to know that vitamin B1 is thiamine. You need to know that thiamine/vitamin B1 deficiency is Wernicke's encephalopathy. And you need to know those 3 symptoms that are manifested in someone with Wernicke encephalopathy: confusion, ataxia, nystagmus. Can, soup can, soda can, pop can. Just kidding. CAN, confusion, ataxia, nystagmus. Boom. All right. Next thing you need to know: polydrug dependence. All right, those are your narcotic dependence. All right, that's you need to know what's a narcotic. So you need to know that narcotics are CNS depressants or central nervous system depressants, and anything that is a depressant is going to depress your vital signs. All right. And signs and symptoms will mimic those depressed vital signs. So your blood pressure is going to be low. Your respiratory rate's going to be low. Your heart rate's going to be low. Of those 3, BP, heart rate, respiratory rate, which one is the priority vital sign? Between a decreased BP, a decreased heart rate, and a decreased respiratory rate. Which one's the priority? Future ER nurse says respiratory. Somebody else, respiratory rate. Correct. Why? I'm prepping y'all for NCLEX. I'm prepping y'all for NCLEX. Why? Why is respiratory rate the priority? Tell me why. What is your rationale? What is your rationale? Why? Okay, Jazz Nicole. ABCs: airway, breathing, circulation. All right. So airway, breathing, it sounds like respiratory rate to me. Obviously, the BP and the heart rate are important, but that's when circulation comes into play, and that is after breathing. All right. If you can't breathe, then oxygen's not even going to be circulating in the heart. It's not going to be pumping, and you're not going to be pumping blood. It's not going to be pumping blood, and you're not going to be I'll just say pumping blood. That's blood pressure and heart rate. Yeah, absolutely. So yes, respiratory rate is definitely going to be the priority. So just in case you see something and it's letting you know which one's a priority intervention. Whenever you see priority intervention, it's usually going to give you options that are all correct. They're all correct. Maybe they might give you one that's like super, super wrong, but majority of them, if not all, are going to be all correct. You have to choose, and I hate saying this, but the most correct. You have to choose the most correct, okay? And that's when you have to really know your test-taking strategies. It's like I told y'all, your strategies are just as important as your content. You gotta know your priority, I guess the rules of priority, basically. All right, your priority interventions. You got to know how it looks when they're asking that. You got to know the test-taking tips on answering priority intervention questions. All right. But yes, all those going to be depressed in someone taking a narcotic. Okay. Wait, I feel like somebody said it, but I need to know. Yeah, future ER nurse. I didn't even ask it, but I was going to say, what is the reversal agent to narcotics? And she said it, Narcan/naloxone. Okay, when it comes to the NCLEX, they're always going to put generic. You will never see a brand name on the NCLEX. I still know it because when you get into the real world, more than likely that's what everyone's going to use, and that's what you're going to use in your patient teaching. But you need to know pretty much both. You need to know both. But on the actual NCLEX, they're only going to list the generics of drugs. So you need to know that naloxone is Narcan, which is the reversal agent to a narcotic. NNN, AAA. All right. And usually that respiratory depression, once again, is going to be the priority intervention. All right. So reversing that agent, reversing the narcotic, when you notice signs of respiratory depression, which is like, your respiratory rate going down to like 10, I don't know, like something real low. Recognize those signs so you know how to reverse it. And usually the reversal would be to at least start with reversing that narcotic. Okay. Know the types of abuse: physical abuse, emotional abuse, and also know the types of neglect as well. You have physical abuse, physical neglect, emotional abuse, emotional neglect, and economic abuse. You also have sexual abuse and then incest. Those are all types of abuse. Make sure you know about those. The main, like all the different, individually, it depending on what type of abuse, it still has the underlining undertone of abuse. So no matter what type of abuse it is, these are some things that you definitely need to know and be aware of when it comes to dealing with clients who are dealing with abuse or being abused. All right. You need to know that you have to report patient abuse to authorities. It's like by law. By law. Report patient abuse to authorities. Initiate a consultation/referral to either like a support group, a community program, social services, something. And then you have to protect the patient from injury. All right. But priority, which is funny, you need to report the abuse to authorities. That needs to be, like, unless they're in direct danger, like being abused, like literally right in front of you. If you're just, assessing signs of abuse and the person's not in direct danger, the thing that you need to do next would be to report that abuse. And I don't know how your chain of command goes, but, whether you have to tell your manager and then you tell authorities, I'm not sure, but reporting that abuse to authorities needs to be the priority thing if your patient is not in direct danger. Okay? You need to know that violence within the family teaches children that the use of violence is okay. All right, so a lot of things, take that and kind of reverse it backwards. A lot of times if you're a school nurse and you see, or maybe a teacher or something like that, and someone's saying that, this child is exhibiting a behavior of violence, usually the next part of the assessment would be, okay, well, is there violence within your family? Because I'm not going to, like, monkey see, monkey do, Wait, hold on. Somebody said, I don't. I always recommend if speaking to a professional when it comes to like your mental health. This is for mental health nursing. But once again, if you feel like you really need help for your mental health, I would either call like the mental health hotline or like a therapist. Reach out to somebody that can help you get the help you need. All right, what was I saying? So report it. Let them know the violence within the family teaches children that the use of violence is okay. And then it says the hostage response. You need to know this. The hostage response is when victims assume responsibility for the violence inflicted on them. All right, so that's important to know as far as your assessment goes when you're trying to interpret, what they say. Just know these certain cues, things that people say as far as like their mindset goes when they're in certain situations. All right, and that's called the hostage response. All right. they assume responsibility once again for the violence inflicted on them. Like, it's something that I did. I was bad mouthing, something like that. They take the blame, they take the responsibility. Next thing to know, it's very important, child abuse. Child abuse and elder abuse. You definitely expect to see those on your exam. All right. Know the signs and symptoms of child abuse. Know the location of specific bruises. And know how, there's a difference between, bumps and bruises from, them playing on a playground and just being, a toddler and a child versus, rope burns, cigarette burns on places where, kids don't fall from the monkey bars. If it's frequently on, the buttocks, the genital area, the soles of the feet, or there's a cigarette burn pattern, those are signs of physical child abuse. Okay, then you have child neglect, which is usually your malnutrition. If there's no or lack of supervision, and if there's a language development delay, that's usually a sign of neglect. Okay. And, neglect can either be physical or emotional. All right. Know how children act if they are being abused. Know their behavior patterns. Little eye contact with adults. They may protect the abuser. And lie and say, no, this person's not, abusing me, not because they want to continue being abused, but because it's out of fear of punishment if they don't do that. Okay, so just know that. Your primary goal for child abuse is to establish a safe environment, period, point blank. Okay? Primary priority, that's a priority word. Okay, so expect that type of question to come up when it comes to priority interventions. So if you see something like that and the question is giving you a whole song and dance about child abuse, and it's asking you about a priority intervention, look out for the primary goal is to establish a safe environment or something that's along those lines. Okay? But it's also just very important to know the legal laws within that specific state when it comes to the state practice acts and the child abuse laws. Okay? Mood disorders. You need to know about bipolar disorder. You need to know the difference between a mania or manic state and a depressive state. All right. Know how clients will act. Know how, they'll even speak when they're in either a manic state or a depressive state. Okay. Let the words help you. Mania, manic versus depressive. Depressive, remember, you get down in the dumps. So their mood is going to be depressed. They're going to lack that energy. They're going to have a negative view. They're going to have a depressed mood, as opposed to someone that's in mania or in a manic state. It's going to be the opposite of depressive. All right. So you're going to have an elevated mood. The speech is going to be loud. And rapid and fast. Okay, they're gonna have grandiose delusions. They're gonna, I don't know if you guys know what grandiose delusions are, but make sure you look that up, get some examples of, especially of phrases. But usually the phrases that they use, you can quickly tell that it's grandiose. It pretty much means grandiose means grand. It's a very large and elaborate illusion. Grandiose. They're also going to be hyperactive. They just sniff the line of Adderall. They're going to be hyperactive. All right. So you got to know the interventions for both of those states. All right. For mania, that hyperactive, always on the go. One of the main things that they're concerned about is nutrition and, them getting their nutritional intake. So your intervention as a nurse would be to make sure you provide them with foods that are like convenient for someone in a manic state. So if they're like going all over the place, blah 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 blah, you don't want to give them like a 5-course meal. They're not going to sit down and eat it. All right, so you want to give them something that's, they're able to take on the go. So like finger foods, and finger foods that are actually high calories, so that when you do get them to eat something, it's more bang for their buck. All right, they're getting more of a higher amount of calories. Okay. Wait, let me see what you're saying. Positive and negative associated with both. A need to know. Right, finger foods. Woohoo. And then as far as that mania, if you have somebody in the manic state, that's bipolar, one of the interventions that you can, you won't be prescribing because that's not your scope, but you can expect to see like lithium. Lithium is a medication that's usually used in patients that are manic. So you can expect to be administering lithium carbonate. All right, or valproic acid or Divaprex, that's both like seizure medications, which is really funny. All right, there's other meds too, like carbamazepine, olanzapine, a bunch of different ones. But for carbamazepine, olanzapine, the lamotrigine is the other big one. All right, for lamotrigine, nursing intervention wise, you want to make sure that you are monitoring for a skin rash. Patient education wise too, let them know to monitor for a skin rash. That is side effect of the lamotrigine, so look out for that. All right, with lithium carbamate, I think that's in there already, but hold on, we'll get there next. For the depressive state, think about someone that has, depression is just really, really super depressed. So your main intervention priority especially would be to assess for suicidal ideation. All right, that is so big when it comes to mental health. You're going to have a lot of unaliving questions. You're going to have a lot of suicidal questions. Okay, so you need to know, you're going to very much need to be able to know how to spot the signs of someone that is having suicidal ideations. Know what it looks like when someone is like serious about it. Do they have a plan? Are they giving away their prized possessions, prized and personal possessions? Are they anticipating failure? Not of the attempt, but just anticipation of just failure overall. And then they're also withdrawing like socially. All right, they're like not talking to nobody. You don't see them as much. They're not posting as much. Just becoming antisocial and withdrawn. Those are signs and symptoms that you need to assess for suicidal ideation. All right, you would administer lamotrigine for this one as well. Okay, wait, hold on, what'd you say? Future ER nurse. Hey, y'all. Oh, thanks, night nurse. Lithium, future ER nurse, she is on it. I was just about to ask y'all. All right, for lithium, that's a drug that has therapeutic ranges. And within mental health, a lot of the drugs have therapeutic ranges. So lithium is one of them. Okay. With anything that has a therapeutic range, valproic acid, I believe, has it as well. Or is it Depakote? No, I think it's Depakote. But the lithium, or anybody with a therapeutic range, in order for them to continue on that medication, they get depending on the actual drug and the doctor, they get regular blood tests so they can see the amount of drug within the system. All right, there's a specific range that is therapeutic for the medication. That's where it's going to work the best, within this little therapeutic range. If it's, if there's too much of the drug in the system, that's when it can become toxic. All right, so you got to know the signs and symptoms of what it looks like when someone's getting toxicity from whatever medication or drug. It's Sebaco. Thank you, Tishan. All right. So when it comes to lithium, you need to know the therapeutic range, and you also need to know the range of, I wouldn't even say the range of toxicity, because obviously if it's over the end of the therapeutic range, it's in the toxic arena. All right. So I think 0.6 to 1.2, depending on the lab, the therapeutic range, I've seen 0.5 to 1.5. But I have not seen over 1.5. So whether it's 0.6 or 0.5 to 1.2, know that just say 0.5 or 6. Learn 0.6 to 1.2. That 1.5 and greater is toxic, because you don't want to say 1.2 and then their result comes back at 1.3 and be like toxic. Sometimes drugs fluctuate, so it has to be like above that 1.5 in order for them to consider it like toxic. Okay. So the side effects of that lithium toxicity, okay, would be increased thirst, increased urination. What does that sound like? What other? Let me not. If y'all picking up what I'm putting down when I say increased thirst and increased urination is a side effect of what other disease or disorder, drop it down below. But yeah, increased thirst, okay, Kika Ross, great job. Yes. Increased thirst, increased urination, fine hand tremors, and EKG changes or just cardiac changes. Those are going to be your side effects for of lithium toxicity. Okay, now this is very important. This is very important. When you have someone on lithium, you always want to encourage them to have to make sure they have what? Do you know? I'm not sure if y'all know. Salt. All right, you want to encourage them to have a normal salt diet. Also hydrate, but you also because they need like 3 liters of water like a day, but they need to have like a good diet of sodium. You don't want to have them like hypertensive because all they doing is like scarfing down, salt. But they should not be on a no salt diet. They need to have some salt. Okay? But in addition to that, they also need to be drinking lots of water, at least 3 liters a day. All right, so make sure you know that. An example of a question that you can get that can easily be like a diet question where they're going to give you like a list of foods, like which one of these diet choices or food plan choices would you recommend for this client on lithium, and they'll give you like different options of like food, like baked chicken, French fries, a hot dog, mashed potatoes, chocolate pudding. Like it'll give you like these different answers, and you need to be able to identify which one. I won't even say which one has salt because it's moderate salt, but like which one which of the foods are like high in salt, high in sodium. All right. So make sure you know that, because that's another way that they take it a step further to really comprehend whether or not you know what you're talking about when it comes to mental health. Okay? Future ER the diuretics are contraindicated when it comes to lithium. Yes, because you need to hydrate. Hydrating is very, very important. So you don't want to, have hydration be like a necessity of lithium, and then you giving them something to dry them out at the same time. It's counterintuitive. Like, what are you doing? Like, you want me dry or you want me diuresed? Well, diuresed is dry. You want me dry or you want me be hydrated? Which one you want? So, yeah, diuretics would definitely not be what you want. Also need to know about TCAs, or tricyclic antidepressants. Okay, that's like your amitriptyline, nortriptyline. All right, and you know the side effects of those medications. One of the big ones is orthostatic BP. When it comes to orthostatic BP, they're usually going to always relate that back to patients falling and injuring themselves. So whenever you see something like that, think back to like amitriptyline. Somebody told me in NCLEX Jeopardy that they think about like that tripping or falling being one of the things that they need to look out for because of the orthostatic hypertension, because they call it Amy trips on things, like amitriptyline. Amy trips on things. It was cute. So cute little memory trick for you. Also, you definitely need to know that you do not give TCAs, tricyclic antidepressants, within 14 days or 2 weeks of MAOIs, or monoamine oxidase inhibitors. Okay? That's definitely on your NCLEX. I'll bet you $1 right now. You will have at least one question on some exam, on some NCLEX practice. You're gonna have that question, so just know it. All right. MAOIs, well, do not give TCAs within 14 days of MAOIs. All right. There needs to be like a little gap between it, because of course now a lot of people need to know, well, what happens if you do? Are you one of those types? I am. If you do that increases that client's chance of getting serotonin syndrome, which is life-threatening. Remember, we're trying to avoid safety. We're trying to avoid injury, any and all injury. All right, serotonin syndrome, absolutely not. That's not what we want. You don't want to write that note. You just don't want to do it. All right. So you need to be able to recognize the signs and symptoms of serotonin syndrome. All right. Just in case, maybe they thought they took their last MAOI 3 weeks ago, but really it was 3 days ago, and now you give them a TCA. That chance of them having that serotonin syndrome is up and up. All right. So you need to be able to recognize how that looks, how that manifests. So increased heart rate, delirium, fever, seizures. All right. Those are some common manifestations of serotonin syndrome. Once again, that is life-threatening. So that is important. Another thing, selective serotonin reuptake inhibitors, or SSRIs. All right. Those are like sertraline, fluoxetine, citalopram, escitalopram, which is Lexapro. You need to know the side effects of that: anxiety, insomnia, skin rash, and a big one is sexual dysfunction. Okay. And when it comes to, starting, and that's important to know because, when it comes to like developmental stages and life stages, a young adult or an adolescent that's like really trying to like sow their royal oats and get into someone's draws, it's going to be a problem for them to be prescribed an SSRI because of the sexual dysfunction. So that's something that you would keep in mind when it comes to that. Another thing is that it's important as far as like patient teaching and education. You need to let them know up front, hey girl, this is not you. If you cannot reach the big O, it is not you. It's a common side effect. Okay? Because they start to think it's them, but harm them mentally. Okay? They start to think there's something wrong with me. Once again, you have to avoid all types of harm, whether it's physical or emotional. All right, so that patient teaching is very important. Sorry, my thing died, so I have to. So gotta go into the book. Wait for it. Already talked about that. It's very important for you to discontinue SSRIs 5 weeks before starting MAOIs. Once again, serotonin syndrome. So for TCAs, it needs to be 2 weeks. T for T. For the SSRIs, it's 5 weeks. Think of it like the S in SSRI is kind of shaped like a 5. If you close one eye and squint with the other one, that S looks like a 5. So make the correlation. Okay? But that needs to be discontinued 5 weeks before starting an MAOI. All right? So MAOIs are like the mean girls. They don't want nobody sitting with them. And that's fine. That is fine. Okay? Speaking of these mean girls that are called MAOIs, all right, examples that you need to... Sorry. Examples you need to know. Trianocyclopamine, phenazine sulfate, carboxazid. Trianocyclopamine is like a big one, okay? One of the big things about MAOIs is the diet when it comes to MAOIs. Can anybody tell me what special diet a client taking MAOIs is supposed to be on? Is there a certain type of food they're supposed to like get more of or avoid? Avoid tyramine, right? So it's important. So that's 2 things you need to know about that. You need to know that you need to avoid tyramine-rich foods, okay? And then you need to know examples of those tyramine-rich foods. All right. Examples include pretty much everything that tastes good. Caffeine, chocolate, cheese, or aged cheese. Let me say that. Aged cheese. Because sometimes, depending on if the NCLEX writer is like an asshole or not, I had an asshole. They'll put options that aren't aged cheese. Okay. Now this is tyramine specific to aged cheese, like cheddars. It's important to know like the type of aged cheese. Like cheddars, blue cheese, those are aged cheeses. A safe cheese is like mozzarella. So if you see a question that has mozzarella, like pizza, well, no, don't say pizza. Don't say pizza. But if you see like something with mozzarella in it, that is not like an aged cheese. So that one's safe. Okay. What's another type of cheese? Cottage cheese, cream cheese. Those are safe cheeses. Okay, so just make sure you know that cheddar is one of the big ones and Swiss, the big ones. All right. So caffeine, chocolate, aged cheese, beer and wine, and avocados. Okay. Those are some of the main tyramine-rich foods. What's the fish? What kind of fish? Tishan, what kind of fish? Shellfish, like a certain, what kind of fish? Oh, another one is like processed meats. I think it's like processed meats, or it's a something type of meat. Like salami, pepperoni, those are bad as well. Tyramine, okay. Know the side effects of MAOIs, which is insomnia, drowsiness, urinary retention, and dry mouth. Next thing you need to know, schizophrenic disorders. You need to know the positive symptoms, negative symptoms, and cognitive symptoms. Okay, you need to know that you have to assess for the 4 A's. Cured meats. Thank you so much. I was like, what's it called? Cured meats. You need to assess for the 4 A's of schizophrenia, and these are what they call Eugen Bleuler's classic symptoms. All right, it's associative looseness, which is the lack of logic, affect or feelings of indifference, ambivalence or conflicting feelings that cancel each other out, and autism, which is extreme retreat from reality via fantasies and daydreams. All right, those are your 4 A's of a schizophrenic disorder. You need to know the disorders of impulse control, like gambling, kleptomania, which is shoplifting, pyromania, which, does anybody know what pyromania is? Pyromania. This is a disorder of impulse control. Pyromania. Pyromania. Fire setting. Exactly. Make sure you know that. And that is a disorder of impulse control. I was just talking about sexuality, all right? Human sexuality is a big part of mental health too. You need to know like childhood sexual problems, adolescent, young adult, blah blah blah, because a part of mental health, like psychiatry, you're getting their perspective, you're seeing what's bothering them. So that's why body image, depending on their age, like the social life and like the way they communicate with their peers and relationships, that's more important to, certain groups of people in different stages of their life than other ones. So you have to know how to, like what they could possibly be like, what kind of problems they could be experiencing based on their stage in life. Okay? So that's in there. We did personality disorders earlier. I do psych disorders. We did the intellectual, we did the Down syndrome, ADHD, autism, separation anxiety, like dyslexia, eating disorders, neurocognitive. Oh, I did that. Defect, body image. We talked about the personality disorders, like the borderline, the antisocial. Yeah, we can go through those. Actually, let's just go through those really quick. 10 types of personality disorders. We kind of touched on it briefly, but I'm just going to go over them and then the different patterns that you can expect to see. All right, so borderline personality disorder. All right, that's instability in interpersonal relationships, self-image and affects, and marked impulsivity. That's the type of behavior that you can expect to see in someone with borderline personality disorder. It's important to know the type of patterns that's associated with these different types of disorders, because how you talk to them or how you talk to, clients with these different disorders, it's going to depend on their pattern. Like how you talk to somebody with manic bipolar, who's a manic bipolar, is going to be different than how you talk to somebody with bulimia. It depends on, you got to know who you're talking to. All right. So, something that I do as well, because I'm a visual person, I have to make connections and associations. If there is somebody that's a celebrity that is, that has a known, like mental disorder, like I associate, when I'm studying those different types, like I associate that with, that person. Like, I'm so sorry, but bipolar, I think of Kanye all day, every day. Oh, he must be going through a manic episode. Oh, that is definitely a depression episode. Oh, Lord. I make the association. It just helps me visualize. Okay? But I really do that with, like, all disorders, to be honest. Antisocial personality disorder. That's the disregard for and violation of the rights of others. Okay? So if you violate and then you disregard, someone said Kanye West narcissist personality disorder. Right. Well, I think about one of my exes when I think about narcissist personality disorder. Ooh, wee. But I associate Kanye with bipolar for real. But he definitely is a narcissist as well. Yes, he is. Histrionic personality disorder. That's excessive emotionality and attention seeking. Excessive emotionality and attention seeking. So that sounds like a drama queen. That's funny. Next one, we just talked about it. Narcissistic personality disorder. All right, that's grandiosity, need for admiration, and lack of empathy. All right. In my notes, I put an F-boy. Insert whichever one you know. Tristan Thompson. Okay, next one is avoidant personality disorder. All right. Patterns are social inhibition, feelings of inadequacy, and hypersensitivity to negative evaluation. Avoidant personality. So that sounds like someone that like avoids confrontation. Avoidant personality. Next one is dependent personality disorder. Submissive and clinging behavior related to an excessive need to be taken care of. It sounds like a pick me, like a yes girl, like a pick me. Yeah, they're dependent on somebody else to take care of them. Schizoid personality disorder. Detachment from social relationships and a restricted range of emotional expression. That's the type of patterns that you can expect to see. Paranoid personality disorder. This one's big. I usually see these as well. Distrust and suspiciousness in which others' motives are interpreted as malevolent. Okay. So that one is very important because the way you communicate with somebody that has or is exhibiting signs of paranoid personality disorder has to be real specific because they're already not trusting you. And establishing trust is a therapeutic technique. And if they have a disorder that makes them distrustful of everybody, you can take that. You can kick that out the window. It doesn't matter. It does not matter. So, the way you talk to them and speak to them has to be in a way to even like further prove your ability to be trusted. Okay. Obsessive compulsive personality. All right. We talked about this earlier. This is the disorder, preoccupation with orderliness, perfectionism, and control. Okay. And I made the point to make sure you guys not always associate OCD with cleanliness and even with only cleanliness. And even though they have, more people with OCD are like clean and cleanly, that's not the only thing that is a huge manifestation for someone with OCD. Okay. That need to control and that perfectionism. Another example that you expect to see that is like, with maybe like a workaholic that like obsesses over like small details, like every detail. I'm just say small, but every detail. They're a perfectionist. So those are important like buzzwords that I still want you to associate with OCD. Okay, right? Those with OCD, they have like little like rituals that helps them feel better, that lowers their anxiety. So if they have to click the lights 5 times in order to feel safe, like they're obsessed about the fact that it has to be 5 clicks. It has to be that way, that the way that they're going to do it. You have a lot of type A personalities that are OCD. They need to be in control. Compulsions. Thank you, PGRners. So just make sure you're aware of those little tidbits. And then another one is schizotypal or typal, I'm not sure. Personality disorder, which is different from schizoid. All right. With schizotypal or typal, it's acute discomfort in close relationships, cognitive or perceptual distortions, and eccentricities of behavior. Okay. Schizoid was detachment from social relationships and just a restricted range of emotional expression. Okay. So it sounds the same. T-John said they also count. Yes, they do. Okay. Really quick, and this is our, yes, they are at risk for developing schizophrenia. These are certain keywords that I want to make sure you guys know the meaning of, because a lot of times you will see these words used to describe speech within a disorder, and so I just want to make sure you know what they are. Like sometimes if you see like flight of ideas or word salad, like I want to make sure you know what that means. All right. So these are talk and stream of thought characteristics. Okay. What you're doing is you're assessing for form rather than like how they're saying something rather than what they're saying, and the way that they're saying it. Okay. So you want to monitor for these disturbances. All right. First one is preservation. All right. Preservation is repeating the same words or movements. Preservation. Flight of ideas. That is a rapid speech, barely making sense. All right. So those ideas are not connecting. All right. It's just random. Blocking. That's sudden silence associated with hallucinations. That is very important to know. All right. It's very important that you're able to assess that, because if it is a schizophrenic patient that starts to do blocking or have a block disturbance, you need to act fast. That is a priority. That's more priority for you to do something about a schizophrenic patient that's having like some blocking versus an anorexic patient having some blocking. You gotta know who, and the paranoid. You gotta know who you dealing with. Okay. Next one is echolalia. That is the repeating of words, phrases, and sentences. Okay. Neologism. It's the coining of new words. And word salad. Jumbling several words together that make no sense. Okay. From what I've seen, they like to test your comprehension of the difference between flight of ideas and word salad, because both of them consist of words that make no sense, but flight of ideas is like rapid speech. So think about a flight taking off, they take off fast, so rapid speech. And then for word salad, just think about a bunch of different random pieces, the cucumbers, the tomatoes. It's a chicken salad. It's a chicken salad. Think about word salad. So it's just jumbling of several things together, almost like a jambalaya. But it makes no sense. You just hope it tastes good. Okay. Hold on, wait for it. Question. Ooh. When you're doing your assessment, one of the first things, like it's any type of assessment, when you're meeting a patient for the first time and you're doing like their patient interview, and you ask them certain questions, one of the first things that you do besides verify the patient is assess their level of consciousness. Okay? You want to assess their level of consciousness. So you're assessing their present mental state. Okay, so that's usually when you determine if they're alert, oriented, like A&O times 1, 2, 3, or 4. All right. When you are doing that, and the questions that you ask, if you're orienting them to if you're testing orientation, you're testing them for orientation to person, place, and time. If you're doing, if you're asking them to name something, you're talking about naming, which is point and ask the patient to name whatever it is that you point to. And then reading, that's when a patient reads a sentence and follows directions. I'm reading mini mental state exam, my fault. And registration is repeating back 3 common words. My bad. I just described the mini mental. So in addition to the A and O times 4, which is, that's what you determine with any interview, the specific exam that assesses their level of consciousness is called the mini mental. All right. I did them more when I worked in like a doctor's office, medical office, versus like the surgery center or the pain clinic. Like I didn't do them there. So it depends on where you work, where you'll have this, but it's more so in like family offices, medical offices and stuff. But those are the things, the activities that you would do: the orientation, the person, place, and time; registration, where you'll ask them to repeat 3 words back to you; pointing and asking them to name something; and then reading a sentence, or having them read a sentence and then follow the directions within that sentence. Okay. What's the cereal of 7s? Ooh, what's that? I think that was everything else that I wanted to say. Yeah, I think that was it. Yeah, so that was basically the content part of mental health. How to that's what we just did, the MMSE, I think. Oh, I know what you're talking about, future ER nurse. Oh my God, I hate that one. Like count backwards from 100 by 7. I was like, I can't do that in a normal day. Like I would fail that part of the exam every time. Count backwards from 100 by 7, too much. I was like, so you just want me to fail? Just tell me now. Just tell me now if I make a fool of myself. All right, so yes, that was the last bit of the content that I really wanted to make sure you had. Thank y'all for this. Definitely went longer than I expected, but I just wanted to make sure you guys were able to really understand the different parts that go into passing the NCLEX, passing these specific courses. All right, I wanted to really explain to you guys why mental health is usually so difficult, and that you're not tripping. It's not just you. All right, it's a difficult subject just because the way that they question, the way you have to actually use your nursing judgment that you're still even developing, it takes a left turn, so it's a little bit different. So just wanted to just make sure I was able to kind of connect those dots for you guys and give you guys some tips, tricks, and strategies that I had that worked for me personally, and that I've also shared with other people to help them get past that mental health. All right, thank you for going overtime. No problem. Listen, tomorrow morning she is going to Mexico for her birthday. Y'all know my birthday's on the 16th, right? It's Scorpio season. But even while I am in Mexico, I'm still doing Tease Tuesday with y'all on Tuesday and NCLEX Jeopardy with y'all on Thursday. I'm going to just have on a bikini and a margarita. Y'all going to have to be mad at me, but at least I'm coming. Thank you for the happy birthday. All right, guys. So, if you want to check out the mental health study kit and you don't have the ultimate third semester bundle, check out our newest bundle/study kit, which is the NCLEX Trick or Treat. This is basically the summary of the review from last month. So this is going to include your care plan stuff, like how to write a care plan, everything about diabetes mellitus, type 1, 2, and everything about like the insulins. And then the mental health was a complimentary. This actual review was supposed to be like 2 weeks ago, but I got sick and it took me forever to actually get my voice back. So thank you guys so much for still joining me for this review. Sorry that's a little late. That's why I did not mind going over. I wanted to make sure y'all had the information. Wait, hold on. Let me see if this... Wait for it. I was trying to see if I had it. No, wait. You can kind of see it. It's fine. You can kind of see it. But yeah, that's the right there. That's the mental health kit that we just threw in there. This is a 70-page kit. Like I said, it's going to go over everything that you need to know for the NCLEX for nursing care plan / the nursing process, diabetes, type 1 and 2, and hypoglycemia. And then you have mental health. All right. If you guys missed the how to write a care plan live video that we did and y'all want to watch that, you can only watch that with the NCLEX Trigger Treat. All right. That definitely includes the, in addition to like the nursing care plan template, it also includes the 2.5-hour replay of the walkthrough and tutorial I did of how to write a care plan from start to finish. Okay, I threw a template in there for y'all, a done for you example with a case study. So I gave you guys everything that you need to write a care plan. This video replay will definitely be given to everybody. Well, this will be put on my YouTube. So if you wanted to watch any of the other like lives that you may have missed, Jeopardy lives, or just like how to pass, how to study for XYZ class, make sure you subscribe to my YouTube, which is at the Nurse Sam TV, or you can just go to the nursesamtv.com. All right, but my username on YouTube is the Nurse Sam TV. Okay, so if you go ahead and subscribe there, you'll see over 100 different videos of me either explaining something or just doing NCLEX Jeopardies and TEAS reviews with you guys. All right, remember, practice your NCLEX style questions. All right, we do NCLEX Jeopardy every week, and we have a mental health category where we get 5 new questions every week, especially if you download the app. So make sure y'all attend that. It's free. It's right here on TikTok live Thursdays at 7 p.m. All right, so thank y'all so much. I'm going to go pack for Mexico. If you have any questions, y'all know where to find me. Thank y'all so much for joining me, and I will see y'all next time.